We're going to go see someone in Italy and in Milan, and I don't think we're going to go. I mean, I think it's probably prudent to, avoid some areas where the virus is spreading. And
I wouldn't let you go.
Yeah, thanks, man.
I'm too concerned.
That's so sweet.
Okay, now that's friendship. Well, as we said right before the break, March break is just around the corner. And as you heard, there are questions, there are concerns about the outbreaks that are crossing the minds of many Canadian travelers right now. So to that, we want to take your questions going forward for much of this hour. And we've invited once again Dr. Isaac Bogosh. He's an infectious disease specialist at Toronto General Hospital. And along with him, Frédéric Dimanche, who is also joining us. He has tips on how to prepare for overseas travel as the virus continues to spread, he being the director of the Ted Rogers School of Hospitality and Tourism Management. And we should, both doctors, one MD, one PhD, as you said. But I'm going to begin with the MD here, because as we talk about COVID-19, obviously with the latest case in Canada, it is a man who had recent travel to Egypt. Not Iran, not South Korea, not China, not Italy, none of the countries that we've considered hotspots at this moment in time. So what does that tell you about what Canadians have to consider before they go and travel?
Yeah, absolutely. I mean, certainly this is a fluid situation, and this epidemic is really moving around and moving throughout the world. And we do have known hotspots of infection, but day by day, we learn about new countries being affected by this virus. We also learn about currently affected countries reporting a greater number of cases. So travelers should be mindful of a few things. Their destination and what the current situation is in their destination, the rules and regulations and policies of the country of origin, presumably Canada, but also any advisories for their destination and any points of contact along the way. And of course, not every place is created equally. Some places have a greater capacity to deal with health issues than others. And certainly the burden of illness in many places is different right now. So there's a lot of different factors that should be taken into account. And I think people should also appreciate that these may change with time. So it's hard to predict, but there's certain things that these are things that people should consider prior to travel.
And so let's begin the conversation, because as we said, we are asking our viewers both on CBC News Network, but also on our social media pages to be a part of this discussion. And to that, someone on Twitter who goes by the name of Sydenham Girl, Sydenham Girl says, just curious, what if you decide now to book a vacation, and when the actual date rolls around, what happens to your trip if we already are on vacation, or if there is a major outbreak and it is determined before departure? What do people need to know when they look at that situation?
It's a complex situation. There are a number of things to know, but the first advice is for people to make sure they're aware of the restriction in the country that they're going to, in the destination they're visiting. So, the government of Canada and other websites are providing information about travel restrictions and information about, what would be zones that could be dangerous to travel to. So that's the first thing. The second thing is about once you travel is to pay attention to the same things that you have been talking about earlier this morning. It's about mitigating the risk in your interaction with people, washing your hands, etc. So those are things that are quite normal. A third aspect, I would suppose, especially if you have not traveled yet, is to check on your travel insurance. Because a lot of us, may be traveling with basic travel insurance or not so basic, and sometimes not at all travel insurance. So I think it's important for people to understand that should something happen in the destination, you want to make sure that you are covered for potential medical expenses. Should you have to go to the hospital, for example, should there be an ambulance service to take you somewhere? You should think about repatriation cost sometimes if there is a risk. We've seen that with the case in China when we had to repatriate a number of people. So I think travel insurance is something that people will be paying a lot more attention nowadays. And in fact, insurance sellers are reporting that the sales of insurance has gone up in the past few weeks.
Well, let's talk about that. What level of travel insurance can one get? Certainly, most Canadian travelers know about medical travel insurance, and because of course even going to the United States, if you're going to spend a protracted time in the U.S., most Canadians will get some form of travel insurance in the U.S. But what about cancellation insurance? What about rebate? What are the different levels of insurance that are actually available for people?
Well, it's like any kind of insurance. There are all kinds of different levels, as you say, and so I think it's on people's responsibility to read those insurance contracts that they might have with a tour operator or a travel agent. But I would encourage them to purchase additional travel insurance to protect them from any kind of cancellations. I have to say that yesterday I canceled trips for my students to go to Europe. They were supposed to go to case competitions and trade shows next week in Europe. I canceled. I had not booked travel insurance. I'm buying the cost.
Mm-hmm. How much does that increase the cost of travel?
Again, it depends on the level. You know, there are some companies that will be selling you a travel insurance for maybe $250 a year. You know, if you're a frequent traveler, that may be a solution that you may want to choose for a specific trip. The insurance may be $60, $70.
Okay. Isaac, I'm going to ask you this next question, and this is from someone on Twitter who goes by the handle Pachamama. If I'm planning to travel to South America at the end of the month in March, what precautions should I take?
Well, that's a great question, Pachamama.
You like the name.
Oh, it's a great name. I mean, obviously, as we just heard, we have to be mindful of any advisories from Canada, any advisories in your destination, and any advisories along the way. We have to be prepared with insurance. But of course, at the individual level, I mean, while you're traveling, remember that in an airplane and in your destination, you might be in many high contact settings. And the key thing is hand hygiene. It's great to have some alcohol hand sanitizer with you, because if you're touching different aspects of an airplane or elevator buttons or door handles, you name it, these are high contact places. It's not just for COVID-19, but of course for other gastrointestinal and respiratory infections that might be on those high contact surfaces. So impeccable hand hygiene is key. I think the other key thing too in general is when we're dealing with respiratory viruses, if you're coughing or sneezing, remember to cough and sneeze into your arm. And of course, if you're feeling sick, if you're feeling unwell, stay at home or you know, stay in your hotel. Don't go out and infect other people.
Mm-hmm. What about the role of wipes? Because, you know, I think about airplanes and everyone shares the headrest, everyone shares the tray in front. When you go to the bathroom, you're touching the lavatory handle, the faucet handle. What role do wipes play in this?
It's really interesting because wipes will really affect whatever surfaces you're in contact with. And of course, we know that different companies have different protocols for cleaning the plane in terms of what the frequency of this is and what products are used. So there's not a ton of standardization across the industry. And, you know, of course, you can use the wipes maybe on the very local area around you, but that's not really going to protect you from your entire interaction on the airplane or through your day-to-day setting. So really the focus should be on hand hygiene and really keeping an eye on ensuring that you're not touching your eyes and nose and mouth after you're touching these high contact areas. Okay,
listen, I'm going to stay with you, Isaac, because we have another one on Twitter, and this is from C. Steele. If we can put up her question on the screen here, because C. Steele wants to know, do we know how long the virus lives on various surfaces outside the body? As we talk about wipes and gels and whatnot, how long does the virus live outside the body?
Oh, that is a wonderful question, and there's a lot of action right now on this front really to better understand this. The current estimates are that the virus might be able to live for hours to a couple of days, and that's really extrapolating from other similar coronaviruses. And of course, it depends on the surface, it depends on the environment, it depends on the UV rays, it depends on the humidity, but the current guess is going to be hours to days. We'll have a much better answer for that hopefully in the short weeks ahead, because that's being evaluated closely.
Okay, so listen, let's end the conversation right now. Of course, this continues on various streams, so we will speak again a bit later. Thank you to the two of you. That is Dr. Isaac Bogosh, an infectious disease specialist at Toronto General Hospital. With him, Fatality, who is the director of the Ted Rogers School of Hospitality and Tourism Management, both of them in studio. Now, again, we have to pause the conversation for now here on CBC News Network and all of our social media platforms. So if you're watching on television, on the web, or on the phone, stay tuned. We're going to continue this conversation right after the break with more of your questions. You can keep sending them in to CBC News Facebook, Twitter, and YouTube. And again, we will continue when we come back. So we continue with your questions about travel in the wake of the COVID-19 outbreak around the world. Dr. Isaac Bogosh joins us as infectious disease specialist at Toronto General Hospital. And with March break just around the corner, we've also invited to the program today Frédéric Dimanche, who is with the Ted Rogers School of Business. He is actually he is a director at the school right now. So let's continue our conversation here. And I want to talk about a woman on Twitter who asked the following questions. I'm going to open it up to the two of you to sort this one out. My daughter is supposed to go to Japan in 2 weeks for work, 1 week. Although she is reasonably healthy, has primary Raynaud's. Her dad has stage 3 COPD. He would not recover from a virus like that. How risky is it since we all live together? What can be done? What should she do?
Good medical question.
Okay, I'll start with this one, and maybe you take it from after. But you know, essentially, the choice to travel ultimately boils down to an individual person's perception of risk and their risk tolerance. And of course, we have to factor that in with current regulations, rules, and advisories. So, you know, we know that this is there's an epidemic. We know that there are a significant number of cases in Japan, and we know that some people have chosen not to travel to Japan because of the current case burden there. Having said that, some people are continuing to travel based on their own perception of risk. And certainly, you know, we know people who might be more negatively impacted from this virus are people who are over the age of 65 and people who have underlying medical conditions, for example, COPD. So while the traveler in this situation might, if this individual was infected, that individual would likely do just fine. But if this individual was to bring home the virus and transmit it to a close contact, that close contact may have a rougher course of infection. So I think these are things that they should be taking into account when considering travel. I think the other thing too is we don't have all the answers. We're still learning more about this virus day by day, and we still don't entirely know what the full spectrum of illness is, nor do we know what the full burden of illness is in certain regions. So I think that also should be taken into account when someone's traveling to a particular destination. This can change with time.
Mm-hmm. Any thoughts, Frédéric?
Well, for Japan specifically, I just found out that Disneyland in Japan closed also. So the main thing, the precaution is not to go to places where there will be lots of crowds. I mean, that's the main thing. We don't want to encourage contact. So if you go for business maybe and you know that your contacts will be limited to just a few business partners, for example, you can really control your interaction with others. If you are planning a leisure vacation and want to go and visit a park or go to an event, you know that in Europe they cancel some football games, for example, soccer games, etc. So basically it's a crowd getting together that we're trying to control.
Mm-hmm. And also Japan has suspended school until April, all schools in the country.
Yeah.
But the Italians did that too for this week, you know, in northern Italy. So again, we'll see what kind of impact that will have in the long term, but they are trying to show that they are doing something. But it's all about, as you said, you know, it's an appreciation of risk. Everybody has different risk thresholds, and you know, we have to consider this. Look, my opinion on this is we tend to be very sensitive to fear more than we have to this virus. In other words, I think we've been infected by the sense of fear more than we have been infected by the virus to our lungs at the moment. So that may change, but when we look at what's happening worldwide, in the media, in social media, people's reactions, fear is rolling at the moment.
Yeah, I do want to pick up on that point, though, because when we talk about COVID-19, in terms of its mortality rate, influenza is still more deadly than this COVID-19. So talk about fear and what is a reasonable amount of caution versus an unreasonable amount of fear when dealing with this when one is traveling.
I think, you know, we have to also remember that we've only known that this virus has existed for 2 months, and there's still a lot of unknown issues related to this virus. Even the mortality rate or the case fatality rate, we're not entirely sure what this is. There's estimates of, you know, 1.5% to 2.5%. It might be a little bit lower when we have a full appreciation of the true spectrum of illness that's inclusive of people that might not have been sick enough to come to medical care to even be counted. So there is because there's so much unknown about this still, that might feed into people's fear. And certainly people are preparing for more and more cases to be imported to Canada and the United States and nearby. We're preparing for locally acquired cases, and I think it's excellent to be prepared. Our senior health officials have been telling us repeatedly that we should be prepared for this. And it's clearly better to be over-prepared than under-prepared for this infection. So fear is a healthy thing sometimes. Obviously, too much of it might negatively impact people's decisions. But I think we should be very cautious about this infection and use that to really prepare for more and more cases here in Canada.
Okay. Another question, and this is to you, Frédéric, and this is from Kim Pham, building on your question or your answer about travel insurance. Kim wants to know, does travel insurance cover out-of-pocket costs if you get quarantined while traveling?
That's a very good question. I don't know the answer. Again, I think there are all kinds of different travel insurances, and it's up to us travelers to go to our insurance provider and to say, what exactly are you covering? And we need to tell them, this is the situation. I could be quarantined. I could be in a situation where I might have to spend 10, 20 extra days, in a country, and I need to know whether those expenses could be reimbursed. Some travel expenses will be covered by your insurance, but again, it really depends on the type of insurance you're going to be choosing. So talk to your travel company and insurance company.
Yeah, I can imagine that travel agents and people that work in the tourism and hospitality are going to have to bone up on those answers as well, because this is a field that people haven't really gone into.
Yes, and sometimes you have a travel provider that is providing an insurance. For example, you book an airline and they sell an insurance as well. Or a travel agency company that sells insurance as well. One thing we're seeing it's a big impact on travel and tourism, especially for some companies that are at risk, like the airlines, for example. We will hear in the next few weeks probably about travel companies and airlines going into bankruptcy. If they go into bankruptcy, the insurance you bought with them probably won't be of any help. So, try to go and get insurance from a third party and possibly a professional insurance.
Yeah, that's good advice there. I'm going to stay with you, Frédéric, because Alan Wong wants to know, what services do Canadian consulates provide in case of emergencies related to COVID-19?
I think we have to go to the website. The government is putting all kinds of different recommendations about which country to visit, what are the risks, for what reason, etc., etc. So that's the main thing. Keep informed. And as we said earlier in the show, we have to look at that information from multiple sources. We may have to look at the information on the government in the local country that we are visiting, because otherwise we don't know. So it's all. I think the onus is on the traveler to get informed and then made appropriate decision based on the information that we're collecting.
Mm-hmm. And actually, I'm going to add to that only because I know that we heard from the Foreign Affairs Minister this past week, and he advised Canadians who are considering travel to go to the Foreign Affairs website, look at all the travel advisories that are issued by Ottawa. You can also register your travel with Foreign Affairs. So if you happen to be in a country that does not have a current outbreak, then all of a sudden develops an outbreak, Canadian consular officials will know how to contact you. So that is your hotel information, anywhere you're staying, your flight information, all of that can be found on the Global Affairs website, in particular the travel section of Foreign Affairs. So let's continue the conversation right now. And this is from Tori Miles on Facebook. And I don't know if you can really answer this question, because Tori wants to know, I travel a lot for business. The airports scare me more than the destination. Going to Latvia soon, should I be canceling? I have not heard of Latvia being one of the centers for all this.
It certainly isn't, but I believe they reported their first case yesterday. I'm not 100% sure of that, but we know day by day more and more countries are reporting their first case or their first few cases, and also day by day countries that are currently affected with this virus outside of China are reporting more and more cases as well. So what we're really seeing is a very dynamic situation of an infection spreading across the planet. And even though people may look at the current risk and the current burden of illness in their destination, by the time they actually get on a plane and go to that destination, that could be vastly different. We saw that in the case of Iran, where about a week and a half to 2 weeks ago, we didn't really know much about the current burden of infection in Iran. And then we had an exported reported case of COVID-19 from Iran to British Columbia. And then, a couple of days later, we realized, wow, there is a tremendous burden of infection in Iran. So, if it can happen there, it can really happen anywhere. Same with Italy. I mean, the same thing happened with Italy as well. So, I think it's really important to stay up to date on this and really keep abreast of this, and also appreciate that things can and very likely will change. And it's not in the distant future, it's in the near future. We will see more of this in the near future.
Okay, one more question. Let's put it up on the screen for people at home to see this question. We don't have it, so let me ask it then. This is from Kat M. And Isaac, I guess this is still for you. Can the virus travel through bathroom vents in a hotel or apartment if someone infected flushes toilet who is sick in same vent line?
Okay, I mean, that's getting a little detailed and a little complicated, but I think it's a
you have your
good
plumbing certificate, don't you?
Yeah, it's a good opportunity to talk about how this virus is transmitted and how most people can acquire this virus. And really, we know that this is a respiratory virus. We know people who are infected with this can cough, and they can certainly transmit the virus through droplets when they cough. And those droplets can be in the near area around a person. Those droplets can fall to the ground with infectious particles in them, and we know that it can stick to surfaces. How long? We're not sure, but it's probably in the order of hours to days. So the way this is transmitted is through coughing and respiratory droplets, and also through direct contact. If someone touches a surface with the virus, it gets on their hand, they rub their eyes, their nose, they put their hand in their mouth, and they can get infected that way. So hand hygiene is crucial, and if people are coughing, make sure they cough into their arm, not into the air around them.
Okay, and very quickly, if you're considering travel, whether it be next week, next month, at the end of the summer, get the travel insurance now?
Get the travel insurance and think about which destination you are choosing as well. Some destinations you don't have a choice. You may be traveling for business, for example, but for leisure you have a choice. So go to destinations that are at lesser risk.
Okay. Well, I want to thank the both of you. Again, that was Dr. Isaac Bogosh, an infectious disease specialist at Toronto General Hospital. Frederic Dimanche, who is the director of the Ted Rogers School of Hospitality and Tourism Management. And for those of you watching online, thank you for joining us. For those of you watching on CBC News Network, stay with us. We have much more ahead. But once again, thank you for the helpful conversation.
Thank you for having us.